The acromioclavicular joint is a small joint on top of the shoulder where the clavicle is inserted. If the AC have any kind of accident like falling off a bike or tackling somebody without shoulder pads, the clavicle can dislocate from the AC joint, spreading upwards and become prominent. That means you can notify it out of the joint, such as the image appear in front of us. Some definition of the AC joint dislocation occur when no part of the clavicle remain touching the acromion bone. That is normally sets in. An AC joint dislocation looks like large bump on top of the shoulder, and the AC joint subluxation is a partial of dislocation, meaning that the clavicle goes partial out of the joint. That means there is still a part of clavicle is still touching the acromion. And AC joint subluxation looks like a small bump on top of the shoulder. About the patient position, the patient mainly begin with arm relaxed by their side. The technique, we make a scan plane, placing the probe in a coronal position, just the image below, bridging the AC joint, slide anteriorly and posteriorly to interrogate the entire joint, because not all the pathology will be central. So what we are looking for, we are looking for narrowing of the joint or any pony irregularity or any fluid, cyst or synovial bulging, and any kind of joint stability. And then we can examine the AC joint dynamically to look for any pony contact in the joint. Clinically correlate if the patient have any kind of pain and scan through from the anterior to posterior, as pathology will not always be central. So here the image can identify the proposition and the corresponding ultrasound image. We can here see the normal AC joint, the two bone, clavicle and acromion, between them the AC joint and the humeral head. So, subluxation or dislocation of the acromioclavicular joint may be a source of shoulder pain, which is often mistaken for a post-traumatic rotator cuff lesion because of the close proximity of this joint with the rotator cuff tendon. Ultrasound mainly is more sensitive than standard radiographer in detecting low-grade sprain of the acromioclavicular joint. These lesions mainly appear as widening of the joint cavity, distended by hematoma or effusion, and bulging of the superior capsule and ligament. Here the ultrasound image, the proximal image or the superior image is the coronal image, and the bottom one is the sagittal scan. We can see the displacement of the widening part between the acromion and the clavicle, and the white arrow indicate that there is increase in the size with the fluid accumulation in the center. Although ultrasound is not routinely used as a screening modality for acromioclavicular joint separation, some attempts have been made to correlate the ultrasound finding in the acute and chronic unstable acromioclavicular joint of varying severity within the radiographic scale described by Tussi. So there is a classification of the AC joint dislocation. Type 2, we have to measure the joint width and measuring index. So how can we measure the width and the acromioclavicular index? Simply, the width of the joint is measured when we're using a coronal approach and compared with the contralateral side. Theoretically, the measurements are best obtained when the patient arm hanging down and holding a 10 kg weight on each hand to increase the stress on the capsule ligamentous structure and allow identification of the subtle changes, since variance can exist in the joint width among normal subjects. The measure must be related to the normal and injured side, and the index then calculated by dividing the acromioclavicular joint width on the affected side by that on the normal side. That means I will divide the affected side over the normal side. In normal subject, the acromioclavicular joint width should be no wider than 6 mm. So the classification number 2, that means instability, have a mean acromioclavicular joint width of 10.2 mm on the injured side and the acromioclavicular index of 0.5. Type 3, instability of the joint, which would be indicator of a surgery. Have mean acromioclavicular joint width of 22.3 millimeter and the index to be less than 0.25. This is type 3. Type 4, marked increase in the distance 2 or 3 times of the scapula displaced inferiorly. And type 4, dislocation of the clavicle inferior to the acromion or the cricoid. Sorry, this is a typo error. It's just type 5. So here the ultrasound image shows how can we measure the width of the joint. We can see here in the image labeled C, we measure the distance between the clavicle and the acromion of the affected side. And here we put just like a parallel line between the acromion and the clavicle, so we measure that width. This is the correct way how to measure the width of the affected acromioclavicular joint. And here in the bottom image labeling by E, we can see the normal and affected side, the width between the acromion and the clavicle, and here the acromion and clavicle will be in the same in the same position, not displaced like the image in the upper part labeling by D.